Hello, everybody. We're going to continue, actually finish up our discussion on the nurse-patient relationship, and this time we're going to focus on complementary and alternative therapies. Our objectives, we're going to talk about the role of alternative medicine and promoting wellness for our patients. Look at reasons why complementary and alternative therapies have increased in popularity. We're going to describe some pharmacologic actions, safety of herbal and dietary supplements. We need to identify common specialty supplements taken by patients, and we're going to discuss your role as the nurse when you're teaching patients about these therapies. Complementary and alternative medicine, or CAM, can be considered outside of mainstream healthcare. It's a very diverse set of therapies and healing systems. Some major characteristics of CAM therapy is that it treats each person as an individual, considers healthcare of the person as a whole, it emphasizes integration of the mind and body, promotes disease prevention, self-care, and self-healing, and it also recognizes the role of spirituality plays. Nurses in CAM therapies, we have long known the healing benefits of this. We know it can reduce reliance on some medications, which is also going to reduce some of those adverse effects of traditional medications. It can bring patients into greater compliance with their therapies. It does have advantages and limitations, so all of that should be discussed with your patients. There are a variety of healing methods, so I'm going to give you some examples for the categories listed on this slide. For ingested therapies, those can be herbal therapies, nutritional supplements, or special diets. Alternative healthcare systems, this could be homeopathy or chiropractic services. We're very familiar with those. Also included in the alternative could be Native American medicine. This includes sweat lodges and medicine wheels. Also included Chinese traditional medicine like acupuncture or Chinese herbals. For the biological based therapies, those could also be again herbal therapies, nutritional supplements, and special diets. Manual healing. Examples of this could be massage, physical therapy, pressure point therapies, and hand-mediated biofield therapies. Mind-body interventions. Those include yoga, meditation, guided imagery, biofeedback, and movement-oriented therapies like music and dance. When we're looking at spiritual, those could be things like shamans, faith, and prayer. And other therapies could be bioelectromagnetics, detoxifying therapies, and animal-assisted therapy. Dietary and herbal supplements have been increasing in usage, and especially with our aging population, most likely being used for things like pain, arthritis, hormone changes, and things like prostate enlargement. A lot of times, people like to use dietary and herbal supplements, and it kind of offsets that prescription drug cost because medications can be very expensive. Dietary and herbal supplements can come in either solid or liquid form. Examples of a solid form would be pills, tablets, capsules, or ointments. And liquids can come in the form of extracts, infusions, teas, and tinctures. Herbal therapies may have interactions with prescribed medications, and that's very, very important. As nurses, we need to make sure we obtain a patient's health history completely and also complete a thorough medication reconciliation. All right, so let's put some application into practice with this presentation. I want you to take a look at this table that's on the screen for you, and I picked out 4 very common herbs that I've seen patients use most recently. So what I'd like you to do is I want you to understand that the medications, the effects, and the manifestations, those are all jumbled up. So what you want to do is you want to go ahead and pause this presentation for a minute. Take a look at those herbs, do a little bit of research, and and decide which medication interacts with that herb. And when you do that, what effect does that herb have? What's it going to do in the body? And then finally, once you've connected all of those pieces, if that were to happen with a patient, what would you see in their manifestations? Nurses play a very important role with CAM. You need to understand as nurses, as well as the patients, that natural does not always mean safer. Some active chemicals are the same in a prescription and over-the-counter medications. If you're substituting alternative therapies for established medical treatment, that may prolong a client's condition. And you always want to make sure that you watch for allergies. Many therapies, many herbs and supplements and those things, they can contain several ingredients, and you may not know everything that's in there. As nurses, we need to keep current with updated information. As always, we need to educate our patients. We need to talk to them about the strengths and weaknesses of CAM, or the positives and the negatives. We need to encourage our patients to seek information from reputable sources. We always need to tell pregnant and lactating women never to take supplements without approval from a healthcare provider. We also need to have conversation with our patients to avoid false hope or cure. Ensure patients understand the uses and limitations of CAM. You want to encourage skepticism of claims on manufacturers' labels and never condemn patients' desire to use alternative therapies. When you're doing your assessment, admitting diagnoses, admitting admissions, you want to goodness gracious, you want to complete a health history. This is going to help you know what the client's taking and potentially avoid adverse reactions or identify drug and herbal supplement interactions. Right, we've finished this session in this presentation. If you have any questions, please post them in the Prep for Exam forum in your Blackboard course.